I've, I've been on the phone with Moderna a number of times. They're a Massachusetts-based company. I've been on the phone with Pfizer, which is not a Massachusetts-based company, but a lot of the work they're doing on the vaccine is being done up in Andover. And Lieutenant Governor and I actually visited them. I've also spent time at Beth Israel with the J&J folks who are running a clinical trial at Beth Israel, among other places. The clinical trials associated with this vaccine are typically involved somewhere around 30,000 people. And it is incredibly important that those trials run, that they run the way they're supposed to, that the controls and the protocols that need to be in place are there, and that the results of those trials are factored into any decisions that get made about what happens next. I have no idea how long those trials are going to take, but those trials need to be able to run completely through their course. The data associated with those trials needs to be collected, and people need to then make decisions on what should happen next based on the results of those trials. Those are just the 3 that I know about that are going on in Massachusetts. There are several others that are going on in other parts of the country as well. I think for me, the big issue is that these be done right, and that whatever happens here has what I would describe as a process and a deliberation and a sort of approval that gives people comfort and confidence that this thing is going to be safe and effective. Now, we've been doing safe and effective work in this country as sort of a global leader on new medicines forever. And the last thing we should do at this point in time is change the way these processes work. I know everybody wants to get there in a hurry, and I understand why. And I'm completely sympathetic to why so many people who can't do any of the things they used to do would love to have a vaccine tomorrow. People who like to go to concerts, people who like to go to sporting events. There's a million different people who want to be able to just sort of go back to the life they had. I get why people want the vaccine to be here tomorrow. But we have a tried and true process for developing these sorts of things, and it needs to be pursued according to the rules and protocols and standards that have always been in place before. Let's see what happens with the trials, and then if the trials turn out to be successful, whatever the process or procedure at that point should be going forward can be implemented. But this shouldn't be based on a date. It should be based on a process and a set of protocols that are pretty standard operating procedure in this country when it comes to this kind of work.